Hello, my name is Dr. Naveen Puri. I'm one of the GPs at Bupa Health Clinics. Today I'd like to speak to you about presenting with problems that may be of a sexual health nature. We know that people can often feel embarrassed speaking about their sexual health because of fear of judgment, some shame or embarrassment that may accompany whatever their concerns are. But please let me reassure you, as doctors, we've heard it all before. Any concern you have, we've probably come across on many occasions, and we're really here to offer you a judgment-free and pain-free service in as far as we possibly can. It's in your interest to tell us all about your symptoms so we can help you get better and prevent any onward consequences that might come into play if you don't seek out help for your condition sooner rather than later. We know, for example, that some untreated sexually transmitted infections can lead to problems with fertility. They can lead to pelvic inflammatory disease, or they can lead to severe infections of the testicles. And so rather than you getting worse and your symptoms progressing on something more serious, let us know sooner rather than later so we can help you. In terms of accessing sexual health services, there are many ways you can do this. We offer the services within Bupa, and you can also access the service within the NHS as well. Some people like to go to a walk-in service where they can turn up and wait for an appointment. Others prefer to book an appointment in advance, and that way they know when they're going to be seen and can arrive at the clinic in an appropriate time frame as well. I'd also say there's nothing to be ashamed or embarrassed about. We have seen and heard all the symptoms before. The kind of things people come to us with range from pain during intercourse, a discharge either from the penis or the vagina, or other symptoms such as abdominal pain, a sore throat, or other things that could occur after an infection is acquired. So whatever it might be, let us do the detective work for you. Let us know what your symptoms are. Feel free to bring someone with you if you'd like, write your problems down so you can then discuss them with us, or use the language you want to as well. We don't expect you to know the medical terms for things. We can help you with that as well. And hopefully together we can get to the bottom of whatever your issue is and provide you with an appropriate course of treatment or indeed cure if that's available as well.